welcome back to my channel. This is your girl Nurse Shaw. Just coming back to you guys with an update on how the life has been post NCLEX. So of course I was an LPN before, took the LPN RN Bridge program and passed my NCLEX June 3rd, I think, of this year. So now today is September 1st. So I'm coming up on my 90 days and just want to give you guys an update. So let me see if I can set this up a little bit better. Okay. Hopefully that works. All right. So, what I've been doing. So, I had already secured a job in critical care prior to graduating. They were just waiting pretty much for me to take my NCLEX, which took forever to get a date for that. Anywho, I have been working in that, and my 90 days for that is coming up shortly as well. I have been really enjoying critical care. So, I have always wanted to do critical care nursing, whether it was ICU, the actual critical care floor, or ER. Like I've always wanted to do those things, but of course, as a LPN, you're kind of limited on certain things. Not saying you can't do it, but they kind of limit you, and then it's like very competitive, versus being an RN. They kind of just slide you in there. So it's something I always want to do. Very grateful that I'm able to do it. So I work 3 12s a week. That is day shift, and I have, let me see, I'm still in my preceptorship. So I've been training like every day that I've been there, which is really hard for me. Like, really hard for me because like I've already been an LPN for years. So to go from being an LPN to now being called the new grad nurse on this floor, it's like, it is what it is. I am the new grad nurse. It is what it is. Anywho, so still in my preceptorship. Um, Nurse to patient ratio. So for a couple of weeks, they had me just one to one. So me with one patient, which really was like a week and a half. And then after that, it was me with two patients. Then a couple weeks, me with three patients, and now I'm up to four. So the maximum we can get is five on that floor. But that's like worst case scenario. So typically, I just been doing like the four patients with my preceptor. I've really been enjoying it. I have been learning a lot. It's definitely different. It's really, really different because I wasn't used to having to do head to toe assessments on every single patient, every single shift. That's different because usually when you work rehab or long term care, you're more going to do a focus assessment. So if they're there post CVA, then you're going to do like the neuro assessment and stroke assessment kind of thing. So you're not going to do a full head to toe on every shift, but um, in this in this setting, we do full head to toe assessments. So I also wasn't used to using Epic, so that's something that's new for me. So I learned Epic. I love Epic. Still love point click care. My long term rehab girlies, I still love it, but I love Epic for that. It has been a challenge, I will be honest, because when you go from being someone who trains people to being the one that's being trained, and then you come into a specialty, you definitely get that nurse bullying and things like that, which try to happen. But you just gotta like show people. That's the easiest way to say it. You just gotta show people better. You can tell them. So it's like, hey, this ain't that. This is not that. This is not happening. Um, and I have a real good team where I work. So when what I said didn't help the situation or didn't calm it down to where I felt comfortable with, went to management and we made some changes there. But other than that, it I love it. I'm just gonna be honest. I really do love it. It is something I do see myself doing for a long time. I do love learning. I'm learning every single day while I'm there. I still read like my NCLEX books. I still read my study materials because certain things like we have a number of people on ventilators. So when that section was up in school, baby, it was up. I didn't stay focused on it, but pretty much all of our patients, for the most part, are on ventilators. You have respiratory therapists, of course, around the clock there, but you still need to know what ventilator settings and things like that because if your respiratory therapist is in a room down the hall, you can't be calling her just to suction a patient unless it's like required that only respiratory suction them. So Other than that, you need to learn some of those settings on the vent, not to change them, but just to be aware of what's going on and aware of, what to communicate to family when they have certain questions. So, respiratory, ventilation, things like that. So that's been kind of new to me. What else been new? Um, Certain drips, like critical drips. We do critical drips, y'all. And I seen those a lot when I did not preceptorship, but clinicals in the ICU. So I saw those critical drips before, but for you to be the nurse over the person on a critical drip, like that's pretty. I don't want to say dope because it's a bad situation for the patient, but just from a new nurse or new RN standpoint, it's something new to me. So it's really nice for me to learn those things. Um, but yeah, it is something I do see myself doing for a long time. It is a little challenging because if you don't have time management skills, you're gonna be effed up. You're gonna be effed up because if you got four patients and you got to do head to toes assessments, and then you have the doctor coming in at 10, and by that time, I'm not saying they're gonna look at every patient, but if it's one that's really critical, and somebody who has a scan that day or something like that, or a procedure that day, you need to have your stuff already in. So I had to learn how to do better time management, which really is not bad when you do long term care. We used to having like 20, 30 patients. So, so it was like boom, 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 boom. So doing that was a huge plus, like already being a nurse, number one, but also working in long term care with, you have like low acuity, but you have a lot of patients. So that kind of helped me a lot with time management as well. What else was new for me? Hmm. Those are like the biggest things. So what I did was I did go on Etsy. I did get a critical care like guidebook from Etsy. It was a PDF version of it or electronic version of it. So I pretty much got one of those, printed some of those. I also have it saved to my iPad just so I can read more up on it, because as I come to my 90 days and I'm no longer in preceptorship, I want to know what I'm doing. I mean, I've been doing it, but I'm just saying I want to feel more confident in what I'm doing in critical care. So, um, that's pretty much it, guys. I am going to go back for my BSN. I'm trying to wait because, of course, I need them to pay for it. I'm just saying, them student loans are no joke. So for this BSN, once I'm eligible for my job to pay for it, I'm definitely going to go back and get my BSN and then go on to nurse practitioner and all that good stuff. But I'm not in a rush. I want to take my time and appreciate the moment and where I am now. So I just want to give you guys a quick update. If you have any questions, just drop them below. I do respond to all comments and all questions that are left on my videos. After I finish my preceptorship, which will be in a couple of weeks, I'll try to update you guys. I will not do any recording on that floor. I know that's been a big thing on social media lately. Like, people been recording while at work. As much as I would love to be able for you guys to like see the day in the life kind of thing, because it's really pretty cool on the critical care floor. It's very interesting, but I'm not losing my license over it. So I will not be doing those type of things, but I will give you guys a couple scenarios of type of patients that I have encountered in my 90 days, the new things I have learned in my 90 days, and just kind of keep you guys updated on my journey, okay? Thanks for keeping up. Thank you for subscribing. Thank you for liking. Thank you for commenting, and I'll see you guys soon.